This is Brian.
This is Katie.
Botulinum toxin. Sounds intense, but really it is something that is commonly heard and talked about, Botox. It is commonly spoke about when celebrities are receiving injections for cosmetic enhancements in order to soften the appearance of fine lines and wrinkles. More recently, we are hearing of Botox for the use of pain management. Keeping pain to a minimum can be a daily challenge for many of us. The use of pain medication, either prescribed or over the counter, can only do so much once the aches begin to come back after the first, second, or third dose given in a day. Now controlling our pain can be much easier and long-lasting with the use of Botox. In order to better understand the use of Botox, we will first discuss what Botox is, the administration process that helps to relieve the common aches and pains that many of us have. So what is Botox? Many of us think of Botox as an injection of a gel-like substance that is used to help reduce the amount of wrinkles, which helps to improve cosmetic features. Well, in some ways this is true. According to WebMD, Botox is a purified protein that is derived from the bacteria Clostridium botulinum. This bacteria produces a neurotoxin that is mixed with a saline solution or local anesthetic prior to being given. The University of Pittsburgh Medicine School.com states that the toxin produced from the bacteria weakens the muscle, essentially helping to relieve the contraction being produced and softening wrinkles or lines in that area. Once Botox is given, it begins to block signals that are coming from nerve endings into the muscle. This effect produces a relief of pain in the muscle area, helping with common aches and chronic pains. Do you have chronic migraines, long-lasting back pain, eye spasms, or muscle imbalances? Have you been able to find a way to help reduce this pain without it reoccurring throughout the day, every day? Botox is a way to relieve chronic pain and help management over time. The United States Library of Medicine states that the above chronic health problems can be treated and controlled with the use of Botox injections. It has also been used to help with overactive bladders, underarm sweating, and uncontrollable blinking. When Botox is introduced into a muscle, it begins to block the release of the neurotransmitter acetylcholine from the muscle. Acetylcholine essentially is a chemical signal that informs our muscles when to contract. So when Botox is given, it causes our muscles to relax, which helps to relieve pressure and reduce the pain coming from that area. By now, you may be wondering how exactly Botox is administered that allows it to penetrate a specific muscle group and for how long this effect lasts on the body. Many may think that when it is given, it is no different than if we were getting it for a cosmetic enhancement. In some ways, this is true, but the way in which it is injected is very different. Unlike if we were getting it for a cosmetic enhancement, it would be subcutaneously or directly under the skin. When we are receiving this injection for the use of pain management, it is given intramuscularly, in less technical terms, directly into the muscle. The UPMC website states that a machine EMG is used prior to the injection being given in order to ensure that the muscle identified is correct. Once the muscle is verified, the injection is given in small amounts in various areas of the muscle. This is to ensure that the Botox will have the full effect to relieve the pain over time. After being given, the American Board of Cosmetic Surgery states that the injection can last anywhere from 3 to 6 months depending on what type of pain it is relieving, whether it be chronic or short-term. Patients are recommended to be seen every 3 months to ensure that the effect of Botox is still continuing to work or whether more will be needed. Botox for the use of pain management may not be a cure, but it is a start. As more studies are done, this form of pain medication is beginning to grow and become offered more. The use of Botox will still come with common side effects seen in over-the-counter medication, but can be effective and long-lasting without the need to continuously remind yourself of taking medication each day. Although I myself am not a huge fan of needles, I believe that an injection given once every few months beats chronic pain reoccurrence every day. I hope that you are now more knowledgeable on what Botox is, as well as the use and administration process when being given for pain management.